Columbia Morning on News Talk 1400 KFRU. Always appreciate the time of Dr. Karli Urban when she comes in to tell us about things that are important. She specializes, I think, in caregiving. Am I wrong on that?
That's right. I'm a geriatrician, so certainly caregiving is a key role in that care.
A geriatrician. That's hard for me to say, but means that you have a heart for and a work for older adults and their caregivers.
Right. That's right.
Let's do right off the bat the Family Caregiver Conference information, and then we can talk about some of the attractions and features of it and maybe some of the reasons why this is important. But what are the details about the conference?
Yes, so we are getting ready to have our third annual Family Caregiver Conference. It will be next Thursday, which is August 15th. It takes place from 10 in the morning until 4 in the afternoon. And it will be held at the Stony Creek Hotel and Conference Center here in Columbia.
Is it a cost?
It is free this year. The last 2 years, there's been a small fee, but thankfully with the generosity of MU Healthcare, it is free this year for all attendees.
So who do you hope to attract to this?
You know, we look to attract those individuals who serve as a caregiver for either a friend or a family member. And that can be a caregiver for a variety of different reasons. A lot of times it's a caregiver for someone with dementia, but also sometimes it's someone that has some caregiving needs due to physical impairments from a stroke. But those that serve as a caregiver for someone in their older ages.
You said off the air that you've already had good response to this year's conference. Sign up is pretty heavy.
That's exactly right. We've already had over 100 registrations, and we can cap our space at about 135. And so it's something that I think if you are interested in attending, I encourage you to go online and register. Because I do anticipate those last seats will fill up pretty quickly.
Now, I have it right here, but what would be the easiest place to go or the way to sign up for this?
Yes, so there's two ways to do it. You can go online to events.muhealth.org, and you can register online there. You can also contact by phone. The number is 573-882-1009. We do accept walk-ups on the day of the conference, but we encourage people to register because when we do reach that maximum capacity, we'll get into a bit of a pickle. So we encourage people to register early.
What kind of presenters do you have at this conference?
So we have a great distribution of presenters. Lois Long, who was the founding director of the Adult Day Connection, will be talking about caregiver support options. We have a group from Aging Best, which was formerly known as the Central Missouri Area Agency on Aging. They're going to talk about advocating for your loved ones. We're going to talk about driving safety assessment, so what we call driving retirement. So how do you maybe approach that conversation with your loved one that maybe they're not appropriate to drive anymore? What are some good ways to have that conversation, and what are some ways to have that evaluation performed?
Do you break into smaller groups, or are you basically, is it a pick and choose the subjects you want to go to, or is it kind of a one program presentation?
Yeah, great question. So the majority of the conference will be held in a central conference area where everyone attends the same presentations. The very last part of the conference will have two breakout sessions. So one breakout session talks specifically about more cognitive impairment. So it addresses what is dementia, how do you do testing, what treatment options are available. And that presentation will be done by Dr. Dasgupta with MU Healthcare. The other breakout session at that same time is more of a focus on physical impairment. So Dr. Brad Willis, who is a board-certified specialist in geriatric physical therapy, will talk more about physical impairments and ways to address that.
What are some of the biggest issues that caregivers face? I mean, the ones that pop up most frequently.
I think a big part of it is isolation. I think caregiving can be a very isolating responsibility. It can be isolating from an emotional standpoint, but it's also very physically trying. Financially, a lot of times comes with large commitments as well. And I think because that caregiving role is so isolating, I think that's one of the great things about the conference is it gives you a chance to meet and interact with other people who may be having similar challenges that you face on a daily basis.
I'm going to say we, and I'm not including you, but we baby boomers are going to really put a strain on those who are our children and who are our potential caregivers in the next 2 or 3 decades.
Right. That's exactly right. And, a lot of times, my own grandmothers included, they want to stay at home as long as they can. They do not want to go, to an assisted care living. And there are a lot of great benefits to doing those types of transitions. However, a lot of times caregivers get in that position, whether they're caring for someone in their own house or if they're caring for someone in a living facility, there's still a lot of responsibility and challenges that come with it. And we want to empower the people that serve in those roles.
That's an interesting comment that you just made. I hope people caught that. If you're a caregiver, even if that person you're caring for is in a facility, it still becomes quite a responsibility and an obligation. I don't want it to sound negative, but I think people know what I'm talking about.
Absolutely. The challenges are a little bit different depending on where the person lives, but the challenge is still there. Even if they're in a facility that gets 24 care, you still serve that caregiver role.
So how do they end up seeing you? In other words, is it because maybe they've reached a certain stage? I don't understand you as a physician. How do they, I don't know where the contact starts with you.
Sure. And so, the role of primary care providers, both in family medicine and in internal medicine, and especially one in the role of a geriatrician, which is what I am, you find that your role as a physician not only is to serve the patient, but to serve the caregiver. A lot of times the information that you get is from the caregiver. And that might be for a variety of reasons. It may be because they have cognitive impairment and they're not able to tell you, oh, she's not been eating for the last few days. Oh, mom's memory has been slipping. And a lot of times it's not the patient that comes forward to see the doctor. It's the caregiver or the family that recognizes that there's changes taking place. And so, one thing that I think is important with the conference is it helps get these people connected not only with resources in the community, but physicians in our local community as well that can provide care for these individuals.
I guess you've answered it, but again, I was wondering because we know as soon as birth occurs, pediatrician.
Right.
Then we move from a pediatrician into a family caregiver or our general physician.
Right.
And then I just wonder if there's some stage in life when I'll reach it, maybe, which I'll say, well, I need to go to a geriatrician.
One of the great things about medicine is everybody that goes to medical school and residency, we have training in all ages of life. And that's one of the unique things, especially about family medicine providers, is you have training from birth until death. And so certainly family care providers and primary care providers are well equipped to take care of geriatric patients. Those that have done geriatric board training, which unfortunately it's not the most popular area of training, certainly serve a valuable benefit in that we have that additional training. But certainly we have a great community of primary care providers as well.
There are certain things that are probably predictable as far as caregiving is concerned and those who need the caregiving, but I think that there are several surprises along the way because you might anticipate, and I'm saying this from a family situation that I know, you anticipate certain things and those might not happen. Somebody might make that transition into moving from driving to not driving or moving from an independent home into an apartment. It may surprise you. I mean, it may be more difficult or it may be a lot easier than you ever anticipated.
That is absolutely right. And it's interesting. It has a mirrored situation both for transitions in living, but also with driving. And so sometimes you dread that conversation of, Mom, you might need to move into an assisted care facility or a nursing home setting. Some patients are very agreeable to it because they recognize that they need that help. And a similar situation can honestly arrive with driving. Sometimes they recognize that that's a concern. On the other hand, that can be a huge challenge and a very big concern and stress on the family because if the patient and the family don't see eye to eye on that, that can be a great time of frustration and turmoil for the family. And that's something that as providers we try to help with as well.
I know that a lot of people fear that, and a lot of dynamics, especially when there is more than one son or daughter.
That's exactly right.
Family Caregiver Conference comes up on August the 15th. It's a week from this Thursday, 10 to 4, Stony Creek, which is on South Providence. For more information, you can go online at events.muhealth.org, or you can call the number 882-1009. And you'll be put in touch with the right people and maybe get registered for that, although places are dwindling fast.
That's
Dr.
right.
Urban, thank you.
Thank you so much.
Dr. Karli Urban has been our guest. You're listening to News Talk 1400 KFRU.